Hey y'all, it's Dr. LaWanda Hill and welcome back to Mental Health in Our Community. I'm excited to take a deep dive into this series, but first let's cover some fundamentals. So I want to talk 5 things to consider when trying to determine if you truly have a mental health condition. The first thing is, of course, the symptoms. I use this metaphor about symptoms when it comes to a cough because I think it's the most easiest metaphor that's transferable. Okay, so a cough could be something as common as a cold. It could be something just random as just allergies, but then a cough could be something a little bit more serious like COVID or the flu. If those symptoms are coupled with other things, which we're going to talk more about, the cluster of symptoms, then we know that we're getting more into serious territory. That same cough coupled with a fever could be the flu. That same cough coupled with a fever plus loss of sense of smell plus difficulty breathing could be COVID. That same cough that's persistent and aggravating, that's interrupting our pathways, could be something even more serious like lung cancer. So the first thing we want to consider when trying to determine if we have a mental health condition is, what are the symptoms and how many symptoms are we experiencing? Are we having those symptoms in the context of just one off like a cough, or are we having them in a cluster of symptoms? Does that cough come with a fever, an achy body, a loss of sense of smell? The third is, how long have we been experiencing those symptoms? Again, if you have a cough that lasts for about 10, 30 seconds, you know that it's something small. If that cough is persisting for a day or two or even a week, we know that the chances are high that we have something like a cold. If that cough persists for months, we may have something more serious on our hands that could indicate cancer or so forth. So the fourth thing is very, very important, and is, how frequent do we experience those symptoms? Meaning, do they come in cycles? Some mental health conditions are cyclical, like major depressive disorder, premenstrual dysphoric disorder. Some mental health conditions are more persistent, like generalized anxiety disorder, like post-traumatic stress disorder. Those symptoms are persistent and they're activated. So how frequent do we experience the symptoms is something that we need to consider when trying to determine if we truly have a mental health condition. And the fifth thing is, how is it interrupting our functioning? Okay, let's go back to our metaphor with the cough. That cough may not interrupt us. It may be aggravating, it may be annoying if it's just a cough, but now you couple that cough with a fever and body aches, then it's very hard for me to do my day-to-day functioning. It's very hard for me to focus. It's very hard for me to get things done that I ordinarily would because I have low energy and I'm fatigued and I'm feeling achy. So how much of our functioning is being interrupted by these symptoms? These are 5 things we want to consider when trying to determine a mental health condition. I'm going to quiz you. Put them in the comments. What are the 5 things? Regurgitate them to me. 5 things to consider when we're trying to determine if we have a mental health condition. The symptoms. How many of the symptoms? How long have we had those symptoms? How frequent are those symptoms? Do they come in cycles or are they persistent? And how much do they interrupt our day-to-day functioning? When you can answer those questions and you say, you know what, I have these symptoms and they come in a cluster, it's quite a bit of them, and I experience them in cycles, or I experience them chronically or persistently, and you know what, they are starting to interrupt my functioning. It's making it harder for me to concentrate, for me to have a positive outlook on life. It makes me fearful. It makes me avoid things. It starts to interrupt my mood and my capacity to connect with other people. If you are able to answer those questions in that way, then we may be dealing with a mental health condition. So save this, like it, share with a friend, share with a colleague or a family member who may be questioning, do I really have a mental health condition? And let them know these are the 5 things that they need to consider.